Good evening, and welcome to the March 17th, 2025 meeting of the East Bridgewater Board of Health. And happy St. Patrick's Day. We will jump right into action items. We have no appointments or hearings today. First set of action items, we have one invoice to approve for Weston and Sampson Engineers in the amount of $4,130.72 for the Bridge Street landfill project. I would entertain a motion to approve the invoice as presented.
I'll make a motion to approve the invoice.
All right.
I'll second that.
Okay. Do we have any discussion? Hearing none. All in favor?
Aye.
Aye. All right. Invoice is approved. Next, we've got minute meetings from the February 3rd and March 3rd meetings. Has everyone had a chance to review the meetings?
Yep. I have.
All right. I will entertain a motion to approve the minutes as presented.
I'll make a motion to approve the minutes.
All right.
I'll second that.
All right. Second, Rob. All in favor?
Aye.
Aye. And then also we have a vote to approve the executive session minutes from March 3rd, 2025, also from our last meeting. And I will make a motion to approve.
I'll second that.
All right, second Rob. Any discussion? Hearing none, all in favor?
Aye.
Aye. All right. Next, we have 2025 permit renewals. We've got installer renewal for Soares Pumping, Inc., Robert Soares. We've got a, should we do these individually? We have some
I would
new
do them
and-
individually. Don't worry.
I would entertain a motion to approve the renewal for Soares Pumping.
I'll make a motion to approve the renewal.
I'll second that.
All right. Any discussion? Hearing none, all in favor?
Aye.
All right, Soares is approved. Next, we have a new installer license for Cut River Excavation, installer Nathan Jr. And application is complete.
It's complete.
All right, I will make a motion to approve the Cut River Excavation application.
I'll second that.
All right, second Rob. Any discussion? Hearing none, all in favor?
Aye.
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 All right. And then last, we have a vote to approve new food establishment, the Greenhouse at 118 North Bedford Street. Owner Sung-Young Kim, and that's it's a takeout business?
I gave it to the board. The board should have information on it. It's a new food establishment, and it's just going to be takeout only. And it was reviewed. So we're going through the process. It's, after tonight, if the board so makes a motion to approve, then we will move forward with a pre-inspection and go from there, and then eventually we will be given out the permit. But their application to date is approved. We did the plan review of the establishment, and they are complete to date.
Okay. So should we vote to approve?
You would vote to approve the food establishment, and then we'll continue with our process.
Okay. All right,
Please.
I will make a motion to approve the new food establishment permit for the Greenhouse.
I'll second that.
All right. Any further discussion? Hearing none, all in favor?
Aye.
Aye. All right. So all three of those are approved. Next, we've got disposal system construction permits. Local upgrade to 22 Ashley Drive. That's by Logan Excavating.
Yes, and I believe in your packet you should have from Eric Badger. Do you have this one? Everyone should have it.
The design flow plan
Yes,
review.
yep. And so down below, so Eric Badger, the health agent from Bridgewater, gave a synopsis in regards to his review of the request for the variance. And his recommendation is the plan, he recommends the plan as designed can be approved under 310 CMR 1500.
All right. And it looks like we've got a reduction from 4 feet to 2, use of a sieve, reduction of the required separation chamber from groundwater, and a reduction of the required number of deep holes per disposal area from 2 to 1.
Yes,
And he's good with all of that?
he is.
All right. I will make a motion to approve the local upgrade for 22 Ashley Drive.
I'll second that.
All right. Any further discussion? Hearing none. All in favor?
Aye.
All right. That is approved. And we are gonna jump into
Discussions?
health board updates.
Nope,
or-
we have one more on the back, discussions on topics not reasonably anticipated.
Ah, we're gonna do
by
that
the-
first? Okay.
Yes. I did receive an invoice from the interim health services that I'd like the board to approve for Eric Badger for a total of $700. And it's for the time frame. Three 4/25 through 3/14/25.
All right, any questions on the invoice for the interim health agent? All right, I will make a motion to approve the invoice for Eric Badger.
I'll second the motion.
All right. Last chance for discussion. Hearing none, all in favor?
Aye.
All right. Looks like that's working out pretty well, and they're doing a bunch of stuff on grant money, so that's also very welcome as well. And we've got a couple of housing issues.
So I think now we'll do
You wanna
what you
jump
said
back
before.
into the
Yep,
full-
We'll do the
full
Board of
update?
Health Board
Okay.
update.
So it looks like we've gone through food inspections for Pepper Hot Sauce, Setauket Pizzeria, Dunkin' Donuts on Plymouth Street, Fiestas, Nanda's, and Deng's Garden.
Yes. So we're utilizing Cindy Metro from HPHEG, our regional health services, and she's going out and doing the food inspections, and I know she's back in East Bridgewater this week, and she has additional, so I'm working with her, and we're getting the establishments, their first rounds going.
Yep.
Is that Lisa?
No, Cindy is, I don't know if you ever met Cindy. She's,
No.
yeah, she
Okay, no
came
worries.
on board with HPHEG.
Gotcha.
Yeah. And she's done a
She's
decent
done them in the
inspections for us
past,
before,
right,
yeah.
a few here and there in the past.
We've got two housing issues that came up, one that's resolved and one that we'll be discussing momentarily. We've had two septic reviews, one for Hereford Lane and one for Ashley Drive that we just discussed. We've got three as-built reviews that came in, one for East Street, one for Hillcrest, and one for Central. We had one open hole inspection on Plymouth Street, a final inspection on North Central, and then we did have an interesting resident complaint. We had a complaint coming in that a business, or I guess this resident had requested to use the bathroom for emergency purposes and was at least initially denied. So we consulted with the HBHEG group about the requirements for bathrooms, and they referred us to Mass General Laws, Section 26, Section 1, which addresses the use of employee restrooms by customers, which is required if they have a qualifying medical condition.
Correct.
So that's not something that I ever came across, but it's interesting to know. So if anyone's listening that is a business owner, if you check out Mass General Laws, Section 26.1, that gives at least the breakdown of the law and what conditions, are triggered by it.
Yep.
So.
So the second part, the second page, start FPHS survey, shared services review. This is part of the state requirement and the regional group, HPHEG, all regional communities having to fill this out. So I sat down with Bob Bucher 2 weeks ago, and we completed the SSC portion. And then I had a meeting with someone on the state side in regards to the cost tool, and that was due on the 14th. Everything is completed. There's one piece that I have to do in regards to a percentage. So I will be getting to that, but it's completed. So East Bridgewater is up to date in regards to this FPHS survey to date. There is still more pieces to it, but we will wait directive by HPHEG.
All right.
And then we're having our 2025 rabies clinic that will be on Monday, June 9th at the COA. Flyers will be coming out. I will soon be placing it also up on the town website. That will be with Dr. Bonnie. She offers her services every year, and we get a really good turnout for dogs and cats.
Right.
And a rain date would obviously be June 10th.
All right, so Monday, June 9th, or rain date of June 10th.
Yes.
All right. We also have an update on the open health agent position. The position has been posted on the town employment page and the MMA careers page as of Tuesday, March 11th. And as of just this afternoon, we've got 10 applicants. So if it's a position you may be interested in and qualified for, we'd encourage you to apply. I believe posting is currently open until the 28th.
Yes.
So,
And the next one, just for the board and just to have a conversation, this morning I received an email from Brown and Cadwell regarding their PFAS analysis that is taking place this Wednesday through Thursday. There's going to be a team out there collecting a sample of all groundwater from wells and surface water locations, and they will be at the landfill. So I got the okay with the DPW, and they're going to ensure that the team will have access to the landfill during this time period. The Brown and Caldwell was also requesting information that our previous health agent was working on, and it was in regards to number 4 here. There was, I believe, to conduct an updated private well survey, and there's significant other steps that are in here. I do not have any information on that to provide the board, so I'm looking for the board's directive and maybe somebody to work with so that we can go ahead and gather this information so that we can provide it back to Brown and Caldwell.
and at this point, we're still looking for
We're
any
still looking.
work that's been done
Yes,
so far anyways?
yes.
All right. I guess that's the first step. Do we have a timeline?
I'm hoping that it's not on
Tomorrow.
Wednesday.
When they're out?
I'm hoping it's not Wednesday. I did respond back to them just saying that I confirmed for their access into the landfill and stated that we will be doing some searching in regards to the documentation survey that they're looking for. And I did not ask for a time frame. I just left it open-ended.
Let them come back and tell us, I guess. But I know we had at least taken an initial look when we were discussing.
I believe that there is something that is out there. I know that she was working on it. We just have to locate it. I believe that she identified all the wells.
Okay.
But I really can't speak to it. I can just go and do a deep dive and see what we find.
So if she was working on, so I'm just trying to get caught up reading here, the owner, which is the town of a landfill, shall evaluate any new private wells identified through surveys as part of this assessment and the landfill's overall environmental monitoring program. If an updated private well survey was completed in the last 5 years, submit that copy. Okay, so they're looking for information that we just don't know where it is. Is that correct? I know that Jean Marie was working on it.
Yep.
We just don't know where it is.
Correct.
Okay. Five non-potable wells identified by, okay. I think it's just a matter of communicating back to them, let them know our situation and.
Yep.
You know,
Nope.
just trying to find the information. There was some level of completion. I just don't recall where she was with it.
No, and they're aware, and then I'll just do a deep dive, and then and then I will ask them how they would like to proceed.
Yep, and then what their timeline is, and
Yep.
so we can maybe gently push back.
That makes sense.
Sounds good. Oh, and then there is the Bridge Street landfill project. That's on the last
The
page
fencing
here.
project, right?
Yep. So we're just, Weston and Sampson is just waiting on getting this signed notice to proceed back from Steelco Chain Link Fencing Company. And then Weston and Sampson will schedule a pre-construction conference.
All right, so the last topic we wanted to discuss, I guess under the topics not to be reasonably anticipated by the chair, is one of the ongoing housing issues we've had that we discussed in our last meeting about attempting to get an admin search warrants. Just to bring everybody up to speed, that was not necessary. We were able to gain access to the home with the health agents, MSPCA, police, pretty much everybody involved, all the stakeholders. The residents are no longer in the home, but we have been asked to consider possible condemnation of the home due to multiple violations and potential dangers to anybody residing in or even just accessing the home. The benefits to that would be, one, it would allow us to potentially shut off things like electricity and gas that would prevent possible sources of ignition if the home is there and uninhabited and inhabitable. And would also prevent any first responders from entering the site unless there was an obvious human there in an emergency. Also, the current residents are out for treatment, and condemning the home may be at least a slight tick in favor of getting them additional services, either where they are now or where they may go in the future. My understanding is our options would be either to vote to move forward for an order of condemnation and an order to vacate, which could be reversed if they wanted to go into the house and do some work and get it back up to condition, or we could do nothing, or we could consider it and delay a decision until our next board meeting.
Mr. Chair, I did, per your request, reach out to the son who contacted the Board of Health last week, and I did leave a voicemail message asking him to return the call.
Yeah, so that's the other sort of complicating issue. We just recently got in contact with the two residents' son who reached out to us. We've reached out back to him. We're trying to see if he would be involved and if he has any plans on trying to help them get the house back up to a good condition. So that is up in the air at the moment, but should be taken into consideration at least as a potential, I guess, a potential method of moving forward. If,
Or at least, as you said earlier, assistance in rectifying the current.
some of the issues.
Right.
Right.
So if I understand this correctly, the potential condemnable conditions report that we have here, that was created in conjunction with HPHG and East Bridgewater Fire? I'm just trying to, I mean, these are some pretty serious,
I mean, this sheet is just the list of potential conditions to check off. I do think we're able to check
okay,
off.
this is not a result of the findings.
No, this is
No,
this is
this
just
is
the
informational.
code that we would
Gotcha.
be applying. But I do think we check off more of these than not.
Are you referencing the email from the deputy chief of the fire department?
Well, I'm looking at that as well. I'm just,
And the previous report by, was it Bob Valerie? Or,
Well, we've had, the services of HPHEG went out on the initial call when it came in from dispatch. And so he's been on top of it. He's been acting as the interim health agent for the town of East Bridgewater in regards to this property. And he initially went out, he did his initial review, and correct, documentation in regards to the status of the property. And in speaking with first responders also on it. And it's just, and he's carrying through right now in conversations with the chair and giving information to the board. And so the potential for condemnable conditions is strictly for informational only. But one thing that Tom was just stating is that the emergency condemnation in order to vacate is something that has been discussed based upon conversations with the HPHEG agent, as well as documentation that you all received too, backup documentation from first responders.
The long list of violations and conditions and defects that was presented to Deputy Chief Windsor,
Go ahead.
where does that reside? I mean, he's obviously making this recommendation based off of Bob Valley's.
Yeah, if you want to talk to that.
yeah, I mean, I think Bob's report, there was a previous report from, I think, the first
It was the initial.
trip out.
Do we have it
Initial.
in-house?
Excuse me?
Do we have his,
Yes, I believe it was the Friday before our previous meeting, this all initially occurred, and then on that Monday, we got,
right, that's
The email
when we
referencing-
voted for the,
correct.
right, but
Yes,
have we physically seen the report?
I have not seen a
Miss-
I have
copy
seen
of his.
The chair has seen it.
Yeah,
Okay, do we have it upstairs?
We have it upstairs.
Okay, fair enough.
yeah.
Okay. So what do you want to do?
I mean, I think the two,
I'm comfortable moving forward with a vote to condemn as is. I mean, we have the documentation. We've been out there, we've worked with both the police and fire. We've got a report back from our deputy chief with some recommendations. So all the pieces seem to be in place for us to go ahead and move with a vote for condemnation.
yeah, I think so.
And with the understanding it's temporary, it's until such time that obviously the condition is upgraded to pass inspection.
Right, right. And I know that was one of my questions. If we go forward, sort of, what are the next steps? Can we reverse? So they would come before the board again, say, here's our plan to fix X, Y, and Z. Here's our timetable. This is how we're going to go forward. And at that time, we can review that. We can either say yea or nay, or
And until such time we have a health agent in place, that, Bob Valley would be the natural go-between, or the person handling this report that we're basing this decision on, that the deputy chief has reviewed. So Bob Valley we shouldn't let this bounce around from agent to agent in HBHG. We should continue to maintain Bob Valley as a contact on this particular housing issue.
yeah.
That
And
makes
his
sense.
recommendation is to go forward with the condemnation.
If the board made a motion this evening in regards to go forward, and the emergency condemnation in order to vacate, we would complete this and then forward it to the HPHEG interim health agent, and then next steps. It's not immediate, as his conversation today in the meeting, but it will go on to the next step, next phase.
But this would also allow the fire department to go ahead and start to de-energize the property.
Once this, yes,
Yeah.
once this takes place, yes. It's still a process. It's not overnight what you
Okay.
were informed,
Well,
but
it's
yes.
something
But
that.
yeah,
But it's the first step in the process, put it that way.
Right.
The
They
board,
could-
yes.
They can bring our order to, the power company, the gas company or whatever to get everything shut off. And the house as safe as possible. And again, if they want to come back and they want to do things and make, corrections and repairs, they can do that, and we can approve that and give them however much time they need, et cetera. So, any further discussion? Are you guys?
Drafted and okay, step 4. So step 3, I believe we've done, drafted inspection report that was done by Bob LaValle. Referencing 105 CMRs. Post picture, okay. And then step 4, draft an enforcement order that lists specific violations with material facts and conditions that support our determinations. Okay, based on the totality of the violations, the Board of Health must indicate that the order of finding the building is harm or threat, doesn't may cause sickness, is unfit for human habitation. Okay.
All right, so I will entertain a motion to move forward with emergency condemnation and in order to vacate pursuant to Massachusetts General Laws, Chapter 111, Sections 127A and B, and the related CMR as recommended.
I'll second that motion.
Any further discussions? All right, hearing none, all in favor?
Aye.
Alright. And if we hear any further information or any further developments on that one, we will try try to keep everybody informed.
Yes.
And make any further changes as necessary.
Mhm.
All right, do we have anything else? Anyone?
Bueller.
All right, I will entertain a motion to adjourn the meeting for the night.
I'll make a motion to adjourn.
I'll second that.
All right, all in favor?
Aye?
Aye.
All right, we will be back April 8th?
7.
7.
7. Back on April 7th, 2025.